Frank Glosnick's mother contracted COVID-19 in her retirement home. She survived. More than a dozen others didn't.
This thing can spiral out of control really quickly.
Glosnick isn't pleased to learn that not everyone working in retirement homes has been getting tested for COVID.
It blows my mind that I'm hearing that. It's unacceptable.
In November, the province made it clear all caregivers and support workers entering long-term care homes had to get regularly tested for COVID. But that didn't apply to retirement homes. In fact, emails obtained by CBC News show that outside caregivers and support workers have not been subject to mandatory COVID testing. Many of those workers serve clients in different locations.
It's like a traveling petri dish is what's happening here.
The union representing thousands of frontline healthcare workers in Ontario wants that to change.
In this very, very vulnerable population, if one caregiver is being tested weekly, then they all should to try and close that seam, that crack.
ORCA, the organization representing more than 700 retirement homes, is also pushing the province to require COVID tests for all workers entering retirement homes, and with good reason. Outbreaks in Ontario retirement homes have increased 70% since September.
More testing isn't necessarily going to prevent those transmission events, but they're going to identify when they're occurring such that they don't ripple down.
In an email to CBC News, the province says it understands the interest in expanding testing for retirement homes and that it will take it into consideration.
I don't think that one person should get tested and another person shouldn't. It should be uniform.
For Frank Glosnick, it's no longer time for consideration. It's time for action. Katie Nicholson, CBC News, Toronto.